we're going to start with bridging. It's a basic exercise that's used a lot in physical therapy, it's in yoga, it's in Pilates classes, and there's a lot of different ways to do a bridge. But we're going to kind of focus on making sure that the glutes are kicking in, and one of the best ways to work with SI joint dysfunction is to engage both glutes at the same time so that you're not doing a single leg exercise that might feed into the instability. So we want both of them kicking in together. Okay, so we're going to do a segmental bridge today. So I'm going to have Heather start with a neutral pelvis, neutral spine, and then doing a pelvic tilt, and then peeling your hips up off of the floor. So to find a neutral position in supine on your back like this, you want to feel, if you do that test again of having the heel of your hands on the pelvic bones, these bones, and then fingertips on the pubic bone, that should create a triangle that's now parallel to the floor. So if you had a marble right in between that, if that marble were to roll towards your belly button, you know that you're in a pelvic tilt. If it were to roll away from your belly button, you know that you're in a tilt the other way. So we want it to be perfectly level. Another quick little test that I like to do is just have people lighten their feet. And when they do that, the weight will automatically go heavy right on the sacrum. And then that's just sort of a place to gauge. And then once you bring your feet down, you can make some little micro adjustments to what's the most comfortable position for you. But that's a nice way to make sure that you're not pushing with your legs and pushing yourself into a tilt and flattening your back. So you want to have a little arch in your low back there.
And I like just sort of feeling my ribs and making sure they're down.
Yeah. So this is another common place that people is easy to kind of flare, and we'll see it a little bit more when we come up into the bridge. So just as a general rule, taking a nice deep breath in, and then as you exhale, when you blow all the air out, the diaphragm will push back up, and that'll allow space for the ribs to begin to funnel down to the pelvis. Okay, and then when you're ready, you can go ahead and come up into your segmental bridge. Nice. So as she comes up, go ahead and go into a rib flare here, Heather. So typically, this is what I see often, and maybe it's done in other areas, but for our purposes, we want to work on keeping the ribs funneling down, drawing the ribs and pelvis towards each other so that we're actually lengthening the low back and not feeding into compressive forces back there.
Right.
And then as you do that, you are going to be in a little bit of a posterior pelvic tilt here. So your pubic bone should be higher than your belly button, or at least heading that way.
And the tailbone's coming up.
The tailbone is pulling up to the ceiling, and that's going to really engage your glutes. So now you're in hip extension. Yeah.
Yeah.
Okay, and then rolling on down.
So again, going one segment at a time.
Yeah, and so here's where we can work segmentally to try to get some mobility through each vertebra in the spine. And then coming back to neutral, take a deep breath in. On your exhale, you'll pelvic tilt. You want to keep the ribs down and then start to come up into your bridge. Good. Okay, and then let's hold it up here. So keeping the ribs funneling. And then do just a little pulse up of your hips, Heather. So you want to make sure again that the ribs are down, the abdominal wall stays engaged. And then, so when this little loft is going to come from just the glutes engaging. So if you feel it in your low back, then you might be a little bit more in a bridge where you're arching your back, and you want to get the core connected a little bit more, lengthen the low back, and isolate the glutes.
And for me, I really have to focus on keeping my knees together because my tendency is to kind of flare like that.
Yeah, so it's good if you have a little ball that you can put between the knees. We could use a Pilates ring, although sometimes that can be pretty wide for people. But there's options of ways to help you keep the inner thighs and the outer thighs recruiting together.
Actually, a yoga block is a really good thing. And from a sacroiliac point of view, we really want to try to keep your knees at the same distance apart as your hips. So it's just like, even when you sleep, you want to sleep with a pillow between your knees if you have sacroiliac joint problems, just to keep that same distance. So it's the same when we roll on our backs, to really try to keep that alignment so the sacroiliac joints aren't flared.
So now we're going to do a side leg lift, and this is gonna really target the gluteus medius, which is the upper part of your butt. So it's this area right in here, kind of right at the top part of the pelvis. So for a beginner exercise, I'd have somebody bend the bottom knee, perfect, and that's gonna help them with stability. You wanna make sure the hips are stacked one on top of the other. You have your bottom hand is like a pillow here, and then it should be as if you are up against a wall, so that the back of the head, the shoulder blades, and the sacrum would be against that wall. Okay, now we'll take this top leg without moving any of that. You want to take the top leg and bring it back into extension. Okay, so right about here, this would be kind of neutral in a little bit of extension. So I like to have people in a little teeny bit of the leg, just a little bit behind the midline of the body. That's going to help recruit the glutes more. So the gluteus maximus is the bigger muscle. And now, Heather, if you can lift your leg up and down. So now you want to feel like the heel is staying in line with the sacrum, the shoulder, and the back of the head. So typically people, because the glutes tend to not be as strong, their leg will tend to float forward, and then they're using other muscles. So here you're actually, it's subtle, but you're actually working both glutes, because this leg is stabilizing, and you can even have somebody press just a little bit into the floor, and then they're getting that nice gluteus work happening to stabilize the SI joint.
So to make sure you're not rolling forward with your hips or with your legs, you can go against a wall, your whole body. It's pretty hard, but you want to go against the wall and then just bring your leg up on the wall and then back down. And then you know you're in good alignment with this one.
One of my favorite exercises for glutes is called a frog squeeze. So you'll have your feet about hip distance apart, and then bending your knees and bringing your heels together. Let your knees bend a little bit more. Okay. And then upper body is just relaxed. You can have your forehead resting in your hands. So now just squeeze your glutes here. So you can squeeze your heels, squeeze your glutes, and squeeze as hard as you can, and then release. And we'll do that a few times. So this might be plenty for people. If you're ready for a challenge, then when you squeeze the glutes here, you can then try floating the knees up and then back down and take a little break. And then do that again. So the goal would be that you're not going into your low back. So you have to use your core to stabilize your spine, so that when you lift, you're truly isolating hip extension from the hip joint, which is going to be your glutes and your glutes and your hamstrings.
So that's hard for me to keep my ribs down in.
And if somebody's really tight in their psoas, this is going to be really challenging, but it's actually going to be really helpful, because we want to do what's called reciprocal inhibition. So in order to help a muscle lengthen or elongate, it's helpful to contract the opposing muscle group. So if you're engaging your hip extensors, your glutes, it's going to help to release and lengthen the hip flexor, which is your psoas.